You're told that the hospitals are the safest place to be when you're sick, that doctors are always right, that modern medicine is precise and bulletproof. But here's what they're not telling you. Medical errors are one of the leading causes of death in the United States. And I'm not talking about rare freak accidents. I'm talking about routine mistakes. Wrong drugs, misdiagnosis, surgical errors, hospital acquired infections, overlooked interactions. Things that should never happen, but happen every single day. In fact, a landmark study from Johns Hopkins, led by Dr. Marty Makary, who is now head of the FDA, estimated that over 250,000 Americans die every year from medical mistakes. That would make it the third leading cause of death, right behind heart disease and cancer. Think about that. The same system you're told to trust, without question, kills 250,000 people a year by accident. And those are just the deaths we know about. Most medical mistakes aren't reported. Many get buried in paperwork, misclassified, or blamed on the underlying condition. You die from a drug interaction. They'll write down organ failure. You catch a deadly infection in the ICU, they'll call it complications. It's a cover up, hiding in plain sight. And no one's held accountable. Why? Because the same institutions making these mistakes control the data, the narrative, and the laws that protect them. You can't sue most hospitals easily. Doctors rarely lose their licenses. Insurance companies settle quietly, if at all. And meanwhile, the media stays silent because fear sells, but exposing incompetence that threatens the illusion of control. Listen, I'm not saying doctors are evil. Most of them care deeply. But they're working in a broken, overloaded system where volume is more important than vigilance, where profits come before patience, and the price of that brokenness is you. You go in for a procedure and live with the problem you didn't have. You trust the prescription that lands you in the ER. You wait for a second opinion that never comes. And when the mistake is made, you're the one who pays the price. So don't just assume that white coats equals safety. Ask questions, demand second opinions, read everything. And above all, take back control because the deadliest mistake of all is trusting a system that's proven it doesn't deserve it.
This presentation represents the professional opinions, clinical experiences, and educational interpretations of Dr. Farah Augustine-Bunch. It is presented strictly for informational, educational, and motivational purposes only. Viewing, attending, or engaging with this presentation, or any content in any form created by, affiliated with, showing, or associated with Dr. Farah does not establish or imply any doctor-patient relationship with anyone. No personal medical advice is being given, and nothing in this presentation should be interpreted as individual medical consultation, diagnosis, treatment, or prescription. Statements made herein have not been evaluated by the U.S. Food and Drug Administration or any international regulatory authority. The experiences and outcomes shared are not typical and are not guaranteed. This content is not a substitute for professional medical advice. Always consult your licensed healthcare provider before making any health-related decisions. Copyright and content protection. This presentation and all associated materials, including video, audio, slides, graphics, and spoken content, are the exclusive intellectual property of Dr. Farah Augustine-Bunch. Unauthorized recording, reproduction, distribution, sharing, or public display of any part of this presentation in any format is strictly prohibited and may result in legal action. By continuing to watch, you agree not to record, screen capture, copy, repost, or transmit this content in whole or in part without express written permission from Dr. Farah or her authorized legal representatives. By continuing to watch, you acknowledge that you are solely responsible for your health decisions. You understand this presentation is not a medical service. You agree not to hold Dr. Farah, her team, or affiliates liable for any outcomes associated with the use or misuse of the information provided. Viewer discretion is advised. This presentation may challenge conventional beliefs and expose controversial topics in medicine, health, and regulatory policy. It is intended to empower, not to incite fear, replace clinical care, or offer medical guarantees. Your health is your responsibility. This is your opportunity to reclaim it.